So far we talked about the conductive hearing loss, then we talked about sensory hearing loss and what are the different drugs that can cause ototoxicity and how noise can cause hearing loss and what are some other non-auditory effects of the noise. So now in the fourth section, now we will talk about some specific forms of hearing loss. And in this, we will talk about the hearing loss caused by the inflammation, which can be due to some viruses, bacteria. Then we will also talk about the infection or inflammation of labyrinth caused by syphilis and familial progressive sensorineural hearing loss. Then we will talk about sudden hearing loss, autoimmune inner ear disease, and presbycusis. So inflammation of labyrinth, also known as the labyrinthitis. Itis is inflammation. Labyrinth is the term used for inner ear. So inflammation of labyrinth can lead to hearing loss. So inflammation of labyrinth can be due to viral labyrinthitis. Virus reach the inner ear by bloodstream, affecting stria vascularis to the endolymph and organ of Corti. So viruses reach the inner ear and reach the organ of Corti and the fluid in the inner ear, and it can cause inflammation and infection leading to viral labyrinthitis. Then we have bacterial infections or bacterial labyrinthitis, and bacterial infections usually reach through the middle ear, tympanogenic, or through cerebrospinal fluid, which is meningogenic. So it can be through middle ear, through tympanic membrane, and it can do from the brain or meninges by cerebrospinal fluid. So bacterial labyrinthitis. Then we have syphilitic labyrinthitis, and the sensorineural hearing loss is caused both by congenital and acquired syphilis. Syphilis is the disease caused by Treponema pallidum, and then it can be congenital and acquired, and both types can cause hearing loss, sensorineural hearing loss. Then syphilitic inflammation of labyrinth, it can be due to congenital and acquired syphilis, can cause sensorineural hearing loss, which may be unilateral or bilateral. It can be Meniere's syndrome with vertigo, hearing loss, tinnitus, and oral fullness. It can be, usually we can have Henneberg's sign, and Tullio phenomenon is also present in syphilitic labyrinthitis. Henneberg's sign is the sign in which there is nystagmus present due to pressure on the tragus. Nystagmus is involuntary movement of the eyeball. So that's Henneberg's sign. And Tullio phenomenon is the condition in which there is vertigo or dizziness as a result of noise. So these are the Henneberg and sign and Tullio phenomenon, also present in syphilitic labyrinthitis. Diagnosis is by interstitial keratosis, Hutchinson teeth, saddle nose, nasal perforation, and frontal bossing. These are all the typical features of syphilis. Hutchinson teeth, interstitial keratitis, these frontal bossing, saddle nose, all these are present in the syphilis. Then lab tests are also performed for the diagnosis. Familial progressive sensory neural hearing loss, progressive degeneration of the cochlea starting in late childhood or early adult life. So familial progressive hearing loss is not the disease or disorder of old age, is a disorder of late childhood and early adulthood, and there is progressive degeneration of cochlea. Here again, these are the structures of the ear. We have external ear, external auditory canal, tympanic membrane. These are the ossicles. Then we have the cochlea, carotid artery, eighth cranial nerve, cochleo-vestibular. Then we have facial nerve here, and these are the semicircular canal. This is the cochlea, and in this progressive sensory neural hearing loss, there is slow progressive degeneration of cochlea. Then autoimmune inner ear disease, immune-mediated ear disease like autoimmune sensory neural hearing loss causes progressive bilateral hearing loss. So autoimmune inner disease, immune-mediated, autoimmune, self-immune system, person's own immune system start destroying the cells which are helpful for the protection or immunity. So auto is self-induced immune or self-immune disorder. Vestibular symptoms like disequilibrium, motion intolerance, positional or episodic vertigo. So in this autoimmune sensory neural hearing loss, usually patient also have vestibular symptoms. Vestibular or semicircular canals, they are associated with position and motion, so it can cause also vertigo and dizziness when the positions are changed, when the patient sit and then stand. So all these problems can occur with autoimmune inner ear disease. Then investigations are by audiogram, speech audiogram, evoked response audiometry, contrast enhanced MRI, blood test, and by Western blot assay for anti-HSP70. This is the mutation in anti-HSP70 that can cause autoimmune inner disease. Treatment is by prednisolone, methotrexate, and cyclophosphamide. Sudden hearing loss. Sudden hearing loss is defined as 30 decibel or more of sensory neural hearing loss over at least 3 contiguous frequencies occurring within a period of 3 days or less. So it's sudden, very fast, within 3 days, and there is loss of 30 decibel or more. So sudden loss of hearing of 30 decibel within period of 3 days. That's sudden hearing loss. Causes of this sudden hearing loss, we can have infections, trauma, vascular, any drug thing that can cause otologic or ear affecting ear, toxic effect, neoplastic effect, any neoplasm or tumor, miscellaneous, or it can be psychogenic. So different factors can lead to sudden hearing loss, which is within 3 days or less. Then sudden hearing loss, these are the blood vessels, then we have auditory cells, cochlea, canal. So all these factors which we talk, they affect all these areas that can cause sudden hearing loss. Management is bed rest, steroid therapy, inhalation of carbogen, vasodilator drugs, low molecular weight, dextran, hyperbaric oxygen therapy, low salt diet and a diuretic, and intratympanic steroid therapy. That's the management of sudden hearing loss. Then also treatment is steroid, inhalation of carbogen, low salt diet, diuretic and hyperbaric oxygen. Presbycusis. Presbycusis is hearing loss, sensorineural hearing loss as a result of aging. It can be a sensory, neural, strial, or metabolic, or cochlear, conductive. So these are different pathologies that can lead to presbycusis or hearing loss due to aging. That was all about some different types of hearing loss. So thank you for watching sqadia.com.